All right, so this is group X-ray, and we are doing case study A. So the first question, we are looking at page 149 in our textbook, and on that page, it is talking about some cultural differences. So question 1 says, as a part of their literal search, which of the following information did the task force of dental hygienists most likely find? And so the correct answer is E, which is both B and C. And the reason for this is because poor Mexican-American children will typically have the highest number of decayed or filled teeth because this population group will most likely not have routine access to dental care because they do not have, the money to routinely go, as well as they most likely don't have the adequate home care to prevent the decay because of their, they don't have the money. And so that is the reason why they would most likely have the highest decay teeth, and then also the filled teeth, because whenever they do have toothache or pain, that is most likely the only time when they're going to the dentist. So then that would correlate to the highest number of filled teeth as well. And then Brooke is going to do number 2.
Alrighty, so for number 2, I'm going to be referencing page 172, and so on that page, it talks about the common dental indexes that are used for dental caries. And so the question is, the task force determines that a similar program for migrant children was conducted in a neighboring state. A report was generated indicating the dental caries rate for the migrant children treated in the program. The caries rates for children were most likely reported using which of the following indices? So for this one, the answer choice would not be A. Answer choice B is a good consideration, being that that one is one of the dental caries indices. Answer choice C would not be one. D is also a good choice, being that it is one of the dental indexes for dental caries. And then CPI would not be a choice because that one is used for perio. It's not going to be used for caries. And so the reason why the answer choice for number 2 is D is because DEFT is all in lowercase, which is what is used for primary care teeth. And so the answer choice B, the DMFT, is used for adult teeth. And then number 3, so number 3 is going to be on page 157 and 158. So I'm going to turn to that page. And so for here, it's the task force represents the Dental Hygienists Association seeks to maximize its resources by utilizing its association members and the financial resources it receives. The most cost-effective caries prevention program for children is, the answer choice is going to be B, topical fluoride treatments and sealants provided by the dental hygienist. So the reason why this is the correct answer is because obviously the fluoride has always been one of the prevention programs. That one was one of the first ones started, that's discussed on page 157, and so a lot of places always do this. But sealants is also a really good one too as well, because sometimes even though they do have an adequate supply of fluoride, you still can get decay, especially if they have the deep grooves and fissures. So by placing that sealant there, it's going to help prevent more decay. And then for number 4, which is page 269, which a lot of these we found aren't exactly word to word in here. It's kind of just a background information, so that way you can use critical thinking to determine the correct answer. So for number 4, it's in addition to developing a dental caries program, the task force members wish to develop an oral health education program targeted at patients with children below 5 years of age. Which of the following topics for an oral health education presentation should be emphasized? So the answer choice is E, which is B and C only. So B is early childhood caries and C is orally safe snacks. So on page 269, it kind of talks about early childhood caries. It's more so referring to baby bottle caries. And so this is still, even though the age group referring to this case study is a older case, like older age, but it's still important for the orally safe snacks, because with the baby bottle, it's going over how you don't want to have them drinking very frequently and like prolonged with the baby bottle. And so you want them to do it right whenever they like wake up and rinse their mouth afterwards, but not all throughout the day, and you don't want to send them to bed with it. So pretty much same thing with snacks. And then for early childhood caries, it's the same way for either one because the caries is the same and it's due to all the sugar and acid staying on their teeth. And then number 5 is going to be Dara.
Hello, my question is number 5. And the question is, the dental hygienist on the task force develops an oral health education program that is bilingual. The use of a bilingual presentation supports the concept of what? The answer is A, cultural competence. Cultural competence means an awareness of different diverse groups and other cultures, as well as being able to apply that awareness in a professional setting. The other answer that you may have been confused by is D, cultural diversity. That is not the answer because you can have cultural diversity but not have an awareness or an ability to communicate with that diverse population. You could have a room full of Mexican Americans and Chinese Americans, but if you're unable to communicate with each other, if there's not someone in that room that can speak one of the other languages, then you are not culturally competent. So the answer is A, cultural competence. And the page is page 148 for that definition, chapter 11. Thank you.